La, la, la. Hey, hey. Yeah, yeah.
Spring means allergy season for so many people out there, and of course for people that suffer from asthma, it's also a difficult time of year, and you have to make sure that you let people know, not only just friends and family, but even strangers know if you suffer from a very major allergy, and that's why a MedicAlert bracelet is so important. We're joined by local paramedics Jill deBoer and Robert Wilson. Welcome to the show. It's great to have you both here.
Thank you.
And can you explain, first of all, the MedicAlert bracelet, Robert, what does that mean to a paramedic when you arrive on the scene, you see that? How much does that help you?
Well, when we arrive on scene, when we're dealing with patients, especially ones that are having severe reactions, sometimes they're not really able to communicate what's wrong with them. So as paramedics, we look at the patient to see if they have MedicAlert bracelets on them, and we can access the information that helps us treat them and get them off to the hospital faster than having to look for all the information before we to treat them.
Right, Jill, people might not know that behind the MedicAlert bracelet, there's a whole team of people. Can you tell us who's part of that team?
So when people join the MedicAlert program, they're completing a questionnaire, and all that information goes to the healthcare professionals at MedicAlert, and then they will determine what needs to be pointed on the back of your MedicAlert. Now there's over 100 different designs. We have some up in front here, but it ranges from bracelets, necklaces, a variety of different designs, and there's a phone number on the back. So we can call that number, and we'll actually get a variety of information. So even though it may say you have an allergy to penicillin on the back of your bracelet, we can call and we can find out medical history, contact information, drug interactions, and a variety of other information that you don't usually anticipate you're going to have or to get.
Right.
Well, you've brought a variety of things along with you here. Is this what is in the ambulance as you're driving around? And maybe you can sort of walk us through here and tell us what you've brought.
So when we arrive on a scene, we basically bring the emergency room to the patient now.
Right.
We'll arrive in. If you're having a severe reaction, we'll initially start you off with a cardiac monitor. It'll take a picture of your heart. We'll put you on oxygen, and then we'll start an intravenous, which is over here to the right.
Over here.
And if you're actually having a real issue with your airway, we actually intubate you, put a tube into your lungs to breathe for you.
Okay.
And then we'll get out medications. We have epinephrine, which are in EpiPens that people take. And we always recommend that if you're having a severe reaction, you should take your EpiPen and have 911 activated right away.
Okay.
In addition to that, we carry Benadryl, and we'll give the patient Ventolin as well.
Right. And before we get to this point, though, if someone sees that their friend or family member or stranger even is not doing so well, what are the symptoms that we should be looking for before we call, before we determine that we need to call 911?
Well, there's the mild reaction, which would just be you'd get some hives and some redness and maybe some watering eyes. That's not the one you're concerned about. You should actually consult your physician, and you can get medication over the counter for it. We're concerned more about the severe reactions. So if they start to have difficulty breathing, their airway starts to swell up, their lips get swollen, their tongue, they definitely have to call 911 right away and assist them with their medications if they have any medications with them. Get the paramedics there, get them to start to treat, and make sure that if you have a severe allergic reaction, that you wear a MedicAlert bracelet.
Jill, how often are you guys responding to an emergency call that has something to do with an allergic or asthmatic reaction?
I can't actually give you the statistics, unfortunately, but we do get a variety of different calls with that in consideration.
Right.
And having that information available to us, as Rob says, you're not planning for emergencies. So when we come to a patient and they can't speak, MedicAlert speaks for them, and the family members speak for them. And so either of those people or either of those services can provide us with valuable information to get your treatment done quickly and efficiently. And maybe kind of, if we don't know, we're detectives. We're trying to find out what's going on. If we're given a clue, we'll start there and then rule it out or work backwards.
Is there a fee involved in getting a MedicAlert bracelet?
MedicAlert does have a fee system, and they have an annual membership, but if you're on a fixed income and you have financial issues, MedicAlert also is 50-year charity, so they also have some other services available for those people that may not be able to support it financially.
Excellent. Well, thank you both for being here. It's such important information to get out there. We really appreciate it. And from all of us at Rogers TV, we really appreciate the work that you do. We know how hard you guys work, and we're certainly happy to have you here.
Great.
All right, we got a great show for you tomorrow. I guess we should end by saying happy birthday to Chloe.
Yes,
should we sing her a little happy birthday song, lounge style?
Happy birthday
To you.
Happy birthday
To you.
Happy birthday
Dear Chloe.
Happy birthday
To you. Not bad, not bad. Great show for you tomorrow. It's World No Tobacco Day. We'll talk about that, all that and more. We'll see you then.